Today we are going to do a bleeding test with the clotting tube. So here are materials: lancets, the clotting tube, which is the capillary tube, and then we have the lancet device, and we shall prick the finger with this lancet device. First of all, we'll put the lancet in it and then close after it. So the patient should do alcohol swab on the finger first of all due to germs on the finger, and then we have to load the lancet, and then we have to prick the finger. After the blood is withdrawn, the capillary tube is over it, and then we have to collect blood from the finger. Press the finger as fast as possible, because after some time the fibrinogen will make a clot, and then we have no blood in the finger. After filling up the capillary tube, blow the capillary tube from 1 to 9 minutes slowly at various minutes, and then clean the finger with alcohol swab. After that, the bleeding time is 5 minutes.